Richard and Julie with you. As Julie just told us on the news, the $1.5 billion revitalization plan for Health Sciences Centre, including a new patient tower on Sherbrooke Street, a new University of Manitoba building to house expanded medical education. In a moment, the Dean of Medicine joins us live. We begin with two in-studio guests. John Lyon is President and CEO of the Health Sciences Centre Foundation. Dr. Perry Gray is with us, Provincial Lead Medical Specialist Services and Chief Medical Officer with Shared Health. Thank you so very much, both of you, for joining us this afternoon. John Lyon, how would you describe the current patient tower, some of it built 115 years ago?
Dated, obsolete, and not friendly for patient care, the loved ones who support them, or those who provide health care. So we're thrilled with today's announcement.
Dr. Gray, is it a sick building in the sense that you want new and fresh, and this is old and dank?
Well, we definitely want new and fresh, but what we really want is privacy when you're the patient so that you can actually talk to your family about your medical condition. Quiet at night so you can sleep. Even if you're not sleeping, quiet so you can rest and heal. We want you to be able to use your own washroom and not have to share. We want the staff to be able to come in and easily move you to and fro out of your room if you need a stretcher or a wheelchair. We want your family to be able to come and visit without having to navigate around furniture.
And those are all the problems with the current facility. So, John Lyon, take a moment here and describe the deal here, because you folks are involved in the takeover of the Manitoba Clinic. There's going to be some services offered there as construction starts, and describe the new tower. So take a moment and describe what's happening.
So, this is something, and certainly Dr. Gray, over the course of his career, 30-plus years, has been advocating for new bed towers. I can tell you, I met Dr. Gray 21 years ago when he cared for my parents at HSC, and they were in these bed towers, and they were so in a rough state, and I've been in them. So what are we doing now? So we've been advocating at the foundation for new bed towers for a long time, working with people like Dr. Gray. And we saw an opportunity, as we've seen, working in collaboration with the province, with Shared Health, with HSC, and with the support of our foundation board, when the opportunity presented itself with the Manitoba Clinic, that, we took a look at it and said, there's some vacant space in here, and we're landlocked at HSC. And in order to build new towers, we need to find a place to build out and manage the patient load and ambulatory patients. So it was just a sort of a pristine opportunity between, frankly, a government that was interested in making an investment and an opportunity to play a role that will fast forward the development of this project by 5 years. So by our acquisition of the Manitoba Clinic by the HSC Foundation, it allows HSC to decant ambulatory clinics into that space starting like this fall, and the project to move ahead. So patients will have better care within 6 years as opposed to 11 years.
So basically, John, you're kind of just moving the pieces around the block. You're not going to tear down that old building yet and rebuild on the same spot. Right.
There's vacant space in the Sherbrooke Loop that is going to be the core of it. And it might stretch a little further, and they'll have to, the hospital will have to work through those details. And then the existing patients will still be in the bed towers for a period of time. But as the new bed towers are built, they'll be able to transition patients into the new bed towers and decant those existing bed towers and transform them in some fashion into whatever is needed. Yeah.
Even though they're old buildings, they could still be used for something.
Well, or they might be torn down as a future phase that some government will have to consider.
And those patients will still be close to surgery suites and everything in the new building.
Exactly.
Dr. Gray, and Richard kind of alluded to this about it being an old, sick building. Are there concerns that building, just in terms of ventilation and those kinds of things, and we talk about you have a patient having their own washroom. It's not, the privacy is nice, but that also is important for infection purposes.
Yes, hospital-acquired infections are a reality whenever you're admitted to hospital, but those odds markedly increase if you have to share your room or if you have to share your washroom.
Or the air, the way that with an old building.
Or the air. And if you don't get the right air exchanges and good ventilation, all of those things contribute.
Also with us on 680 CJOB is Dr. Peter Nickerson. He's Dean and Vice Provost of the Health Sciences at Max Rady College of Medicine. Dr. Nickerson, there's another building being announced today. This is at McDermott in Tecumseh. Tell us about that build.
Yeah, thanks, Richard and Julie. We're excited about this. This is the space that we're going to need as we expand the medical school class and our postgraduate training. Earlier in the year, Manitoba government announced the expansion of the medical school class by 15 this coming fall and another 15 the subsequent year. And as we continue to expand our programs to meet the training needs that will support our health service delivery in Manitoba, we need to have additional and newer training space. This building will start to meet that need.
How key is it to attracting the best and brightest to come and study, learn, work, and hopefully stay here?
Yeah, I think certainly the training facilities need to be upgraded and more state-of-the-art, but I think the announcement by HSC and Shared Health and government today, creating key and state-of-the-art space is what will attract physicians and others to come into this province. They'll see that as a better work environment for themselves. They'll know that they're delivering proper patient care, and certainly our trainees will enjoy that environment to learn within. So I think it's a win-win for both the training system and and patient care, as Dr. Gray has already alluded to.
John Lyon, so when do we expect shovels in the ground?
That's a great question. I mean, I'd be getting ahead of myself if I put a date on that. We know, again, the project trajectory is around 6 years.
But this is not just another election promise. This has been signed, sealed, and delivered, right?
We have a long-term agreement for the space. HSC will begin the process of decanting as soon as, immediately. And those people will move into that space we expect this fall.
And Dr. Gray, as a physician who's been at it for 30 years, this is a proud moment, isn't it?
This is a moment I've waited most of my career for. And I'm really glad that I stayed in healthcare long enough to see it.
What does it mean for the ones that are at the beginning of their career now?
I always envy the ones who are at the beginning of their career, because they're going to be able to provide better care than I could when I started. That's the other benefit of this building. When I started in medicine, things that were verging on science fiction, the way I was trained, are now standard of care, or as I call it, science fact. And so I'm very envious of the young physicians, because they're going to be able to do a lot more than I could, a lot better, and it's going to be much more rewarding for them to take care of patients, because they'll be able to achieve more and do more.
Thank you all for joining us this afternoon.